Did you know that colon cancer is the third most common cancer in incidence and the second leading cause from death from cancer? Well, according to statistics by the American Cancer Society, prevention and self-care is key when it comes to good health. We have joining us now Dr. Mariya Kobi. She's a Montefiore Radiologist talking to us about colon cancer. And good to have you, Dr. Kobi.
Thank you for having me.
Good. So, as we said, this is the month, really, where we're paying real good attention and awareness to colon cancer. For people who don't know about colon cancer, give us a little bit of background.
So, as you've mentioned, it is the second leading cause of cancer deaths in the United States, and over 90% can be prevented by screening. Colon cancer arises from a polyp. Majority of colon cancers arise from polyps that are in the colon, and that can be prevented by screening tests. Now, interestingly, there was a survey done in the Bronx that was funded by National Cancer Institute that looked at various factors. One is that non-native English speakers are less likely to be screened than general population. Also, that we found that we need to talk about screening tests 5 years before we actually get screened. Also, African Americans are at higher risk for colon cancer than the remainder of population.
So looking at this now, obviously the word of awareness actually comes out. Is there any particular reason why we're finding that people aren't taking advantage of screenings? Is it the fact that they just don't know, or is there that fear factor? What are we talking about here?
Probably it's multiple things that you've mentioned. That's why we're here, to encourage the screening. American Cancer Society recommends screening for anybody who is over age 50. There's several screening tests available for colon cancer screening. The most common one is colonoscopy, that everybody I'm sure have heard about. It's performed by a gastroenterologist under anesthesia. A scope is placed into a rectum and is passed throughout the colon to the beginning of the colon, and as the physician passes the scope, they're able to remove the polyps as they see them, or take biopsies of any lesions that look suspicious. There are other alternatives to colonoscopy, virtual colonoscopy, and I'm a radiologist, so I know a lot about that. Virtual colonoscopies are done in the radiology department. They do not require sedation, which may actually be a good alternative for people that are either afraid of anesthesia or have multiple diseases that can cause complications secondary to anesthesia. And that is done in the radiology department. Patient comes in, a thin tube is placed in the rectum. The colon is distended by gas, carbon dioxide, which is absorbed by the body easily, and then we exhale it. When the colon is distended well, we take 2 scans. One scan with the patient lying on their back, and the other scan with the patient lying on their side or in their stomach. Each scan takes 10 seconds. Once the scan is done, the patient is able to go on with their daily activities for the day since there's no anesthesia. There are other advantages to virtual colonoscopy, aside from anesthesia, is that we also scan the entire abdomen it's a CAT scan. So we scan the entire abdomen, we can find diseases or early cancerous growths elsewhere outside of the colon. The downside of virtual colonoscopy is that, as opposed to regular colonoscopy, if we do see a polyp, we cannot remove it during the exam.
Right.
However, only 1 in 300 patients that undergo virtual colonoscopy have a polyp that needs to be removed. And the risk of perforation with virtual colonoscopy is significantly less. Interestingly, former President Barack Obama, when he had his screening test for colon cancer, decided to go for virtual colonoscopy. So
it made it a whole lot, it made it a whole lot more popular to other people after hearing and seeing what he actually did. So let's talk about the process. If one is diagnosed with colon cancer, what goes from there? Because of course there's a big fear factor that's attached to that. What are the treatment options that are available for anybody who's been diagnosed?
So first of all, screening is the key. And if you do end up with a polyp that is removed that is cancerous polyp, usually these cancers are picked up very early on. They're easier to treat and with less morbidity. If the colon cancer is picked up, then your physician or the specialist that you're seeing will send you to an oncologist and surgeon to decide the next course of treatment. It will depend how aggressive the cancer is, how far it has progressed, whether you'll need surgery or you'll need some more systemic chemotherapy type of treatments.
And right now at Montefiore, there's a very special program taking place today.
Yes, we will have a Twitter chat later today at 4 o'clock at Montefiore NYC talking about colon cancer, answering questions. There will be multiple physicians, radiologists that will be live answering questions.
Now, I don't want to steal any thunder, but what are some of the more frequent questions that you do get asked about?
Well, the questions that we do get asked is how often do we need to get screened? So the American Cancer Society recommends screening with colonoscopy after age of 50 every 10 years. And if you opt out to get virtual colonoscopy, it should be done every 5 years. So that's a question that we often get asked. People do not know about virtual colonoscopy. They do not know the differences. So we often get those questions, and sedation is a big thing. When people hear that virtual colonoscopy does not require sedation, people get excited,
Right.
because often people are scared of anesthesia.
Right.
And we talk about the risk of perforation during complications during the different screening tests. So one of the complications is perforation of the colon during the procedure, and virtual colonoscopy carries significantly smaller risk of perforation.
So we want to tell people that you can take part in the Twitter conversation. What they have to do is just log on and go to Twitter. You can have that Twitter conversation talking about colon cancer screenings and awareness. And this month is the month of awareness, and there's going to be the screenings and also some tests available coming up too, right?
Right. And I think the key to remember is that over 90% of cancers can be prevented by screening tests. And people, the moment you hit 50, you have to speak to your physician, to the specialist about screening, whichever route you decide to go.
All right. Well, Dr. Kobi, we want to thank you so much for coming
Thank
and
you.
sharing with us. And we, of course, want to tell you, if you want to be a part of that Twitter chat, 4 p.m., you can go on and find out more about colon cancer and colon screenings. Taking a quick break. We got more show coming up. We'll be right back right after this.